You are live. Where am I? Where am I? I'm live. Hello. Hello, hello. Okay, I'm getting all my screens where they need to be so I can see. How's everyone doing? Happy Monday. I almost said happy Tuesday. I'm already ahead of myself on what day it is. Oh my goodness. You could see my name. It says Whitney, and I am a registered dental hygienist. Ooh, I didn't get the yellows to match, but that's okay. Next time we're gonna get my my shirt to match the name. Hello, Courtney. Thank you for being here. Hello, Brand, new member. Thank you for being here. Fred, Young West, Jay, Paris. Hello, hello. Paris up with a question right away. I'm going to answer right away and then do my intro. But you asked me what made me choose general over pediatric dentistry as a dental hygienist, and it's just where I happened to apply as a hygienist when I was first applying for jobs. I just happened to apply to a general office, got the job, never looked back. I was really happy with my the balance of seeing all different patients, right? Not just kids, not just adults, not just seniors, at every age. So I just never really looked back. And okay. I'm so excited to see. I'm going to read these questions now, but first I just want to do my little spiel because I want to say, don't forget. Thank you. First of all, thank you so much for being here. Thank you so much. I truly, I am so grateful and thankful that we have a community of people who care about teeth, right? And care about dental health. This is just so cool to be here. So thank you for being here. So yes, I am Whitney. I'm a dental hygienist, a registered dental hygienist in the US. And, this is going to be a Q&A. You can ask me anything. I know you're already asking some questions. I'm going to go through them. And then it can be anything, though. If you don't know what you want to ask or you just want to sit and watch, that's great, too. We love a viewer. I'm all about being a viewer, right? So yeah, but you could ask me anything about being a dental hygienist, like schooling, careers in dentistry, anything like that. Or maybe you have a question, like a specific dental health question, or just about life, whatever you want to ask. Let's talk. And don't forget to press like on this video. The more likes we get on this live stream, the more people we can help. So awareness is key. And the whole reason I do what I do is for dental health awareness. So the more people that can know about dental health, the better. So please press like if you're in here. It helps so much so we can talk to more people about more toothy topics. So, and then also loyalty badges. Sometimes I see these in the comments. Am I seeing any in the comments? Let's see. The loyalty badges. Yep, there. My pal Potsy. There we are. Okay, so these loyalty badges are really cool. The colorful tooth emojis are depending what platform you're on. Sometimes there's a star next to the name, whatever it is. Oh my goodness, Potsy, thank you. Oh my goodness. Okay, so Lee just gifted 5 Teeth Talk Girl memberships. So wow. What a good segue. Thank you for doing that. That's so nice. I was just about to talk about what the YouTube membership is. If you're a member of the community here on YouTube, it's kind of like a Patreon, if you've ever heard of Patreon, but it's all on YouTube. It's a membership where you can get these loyalty badges that I'm seeing in the comments. You get monthly check-in videos, upcoming video topics. Every month I give you all the topics I'm about to do for my long-term videos and extra fun stuff like that. So, so if you want to join, please join. Or maybe you're lucky enough to be someone who actually won you received a random gift of this membership by being in this live stream brought to you by Potsy right now. So anyone can gift membership. So that is so awesome. So thank you. Hello, Potsy. Thank you. Oh, that just showed up on the, did you all see that? Did that show up for everyone? Let me know. Okay, I'm going to go through. Thank you so much. Thank you so much. Okay, so I'm seeing all these questions. I'm so excited. So I'm going to go through them. Okay, where did I leave off? Okay, everyone say hello. This makes me so happy. Hello. Hello. Okay. Okay. Hello, Whitney. How's it going? Have you ever been to Japan before? I have not been to Japan, but I would love to go to Japan one day. That would be such a cool trip. That is actually on my bucket list of places I really would love to go. Thank you for the flossing tips. The Joe said, thanks for the flossing tips. My teeth are really silky. Okay. Love to hear the word silky. I love a silky tooth. Thank you for telling me that and keep up your flossing. I love that. Keep it up. Someone asked one mule asked any advice for someone getting braces. So I'm sure anyone who's had braces or clear liners can attest. My best advice is keep your teeth clean. Keep them clean. Keep them as clean as you can. You got to brush. You got to floss. You got to use a water flosser. You got to use those little proxy brushes. You really do got to use all the tools at home. You know what's so funny? I brought a little baggie of things this time. There's nothing that amazing in here. I mean, like here, wait, you're gonna be like, what? Yeah, I have a string in this baggie. It's a floss. I tried to bring some like home care products in case anyone asks about technique, to like show technique. But yeah, so my point is, here's a floss here. Proxy brushes, to clean your braces. You just want to use all the tools you can at home, and also check out my YouTube video. You can just type braces teeth talk girl in the YouTube search bar, braces teeth talk girl, and my video will pop up for you. And I give very specific tips on how to care for braces. But yes, and number 2, well, I know that was my advice, but then also I just want you to know that it's going to be worth it. I'm so excited for you. It's going to be so worth it. Someone just asked, how can your name be Whitney? I don't know if it's a joke because I always say like teeth talk girl, but it's my name that I was born with is Whitney. I don't know. I'm assuming that was a joke. Okay. When will the Better Mouth app come to Android? Very good question. Love that. So I am the oral health advisor for the app, but I am not the creator. I would never know an app from I don't know. You know what I always say is I never used to know a tooth from a toenail. That used to be really funny. Like, like explaining how I started with no tooth knowledge. I'm like, what do I say? An app from an apple. There you go. I don't know, an app from an apple. Anyway, my point is, but I work with the team, and they were starting to integrate that January 2026. So that was a few months ago. Wow, time flies. So I know the goal was January 2026 is when it was starting to integrate into Android, but they don't have an exact date on when it will be fully integrated. But the good news is it's in the process. So hopefully sooner than later. But once they know and they have a date, I will definitely announce it as soon as they tell me. So I'm excited. Thank you for asking. And make sure you're on the wait list, bettermouth.com. If anyone wanted to know what Courtney was asking about, if you don't know what the app is, it is a toothbrushing app, right? It's a Better Mouth habit forming app. So it's called Better Mouth. Can I type that somewhere so you can see it now that I have all these cool features here? I don't know. Maybe I could type that somewhere. I'm going to try this. Okay. But while I'm figuring this out, I'm also going to tell you about the app. So long story short, how many times can I say long story short? That is my favorite phrase, and I need to work on that. We all have phrases we like or words we like. Could be worse. Anyway, long story short. The Better Mouth app. So you can log your brushing and flossing and tongue scraping. I did bring a tongue scraper too for my all my props here today in case. Anyway, you log all your stuff up in the app. It's kind of like, like the Peloton app or the whatever you do, and you track your exercise or you track your whatever. So you track your oral care. And when you get so many days in a row, you can get streaks and such, and you could win things. So there's like challenges every month. So say, the challenge is different every month, but say it's like floss 15 times in April and you can win free whitening strips. We partner with different companies to provide you free product for brushing your teeth. So, and it's a free app. So there is a free version and a paid version, but the free version, just try it, try it. You know what I mean? You get free stuff for brushing your teeth. So the whole thing, I was so happy to work with Better Mouth. I make sure everything on the platform is evidence-based and science-backed. I make sure all the information is good. I was so happy when they asked me because I was like, yes, I love the idea of an app to encourage healthy toothbrushing habits. Okay. Sorry, that was a long answer for what I was asked. Can't help that sometimes. Someone said, hi, I'm Whitney. Thank you, Potsy, for asking. Oh my goodness. Okay. So Potsy's been a member for 51 months. Does everyone see that? That just popped up. I didn't even do that. I don't know. That's just popping up here. Like I said, we got all these new gadgets now. Okay. So if you're watching on the vertical version, it's up here. If you're watching on the horizontal version, it's down here. So it depends there's a lot of new things going on the YouTube. So thank you for being a member for 51 months. Isn't that amazing? Wow. 51. Okay. Florida was amazing. Thank you so much. I am in Chicagoland, so it's been very chilly here. So it was so nice to go somewhere where it was warm. Oh my goodness. Wait a second. We got another. Thank you for asking. Sorry, I got distracted. You all know how this happens. Thank you, Tim Beck, for the support. Thank you so much. You have a question here. I am getting my wisdom teeth out in 2 weeks. All 3 are impacted. I decided to stay awake. Okay, so you're getting them out in 2 weeks. 3 of them, all 3. So is there a 4th one? Okay, doesn't matter. Let's keep reading. I decided to stay awake and just have local anesthesia plus the gas. How worried should I be? I've been overthinking a lot for a month now. Oh my goodness, Tim. No, I get you. So don't be worried. You're going to be great. I'm happy you're getting, you put the gas. So I'm assuming like laughing gas, nitrous oxide. You're going to be great. You're going to get nice and numb. So the only difference is you're not going to be like fully asleep. However, I will say, depending on I don't know if you've ever had laughing gas before, but if depending on I don't want to say like, hold on, I'm trying to use like a more proper term than I was going to use like a term for like people who drink, like depending on how lightweight you are, but I guess it's the best way to explain it. Depending your tolerance, okay? Sometimes the gas can make you feel like you're basically asleep anyway. So have no worries, right? If you are like, your tolerance is very high and like the gas isn't going to do too much for you, don't worry about that either, because you're still going to be relaxed and you're numb. It's easy. You know what I mean? It's like getting 3 teeth pulled. Yes, impacted is a scary word and it sounds scary, but if you're going to an oral surgeon, I'm assuming oral surgeons do this every single day, all day, every day. They're just going to do it, get you in and out, right? So you're going to be great. My best recommendation to you is actually, if you are feeling, you just said you've been overthinking a lot about it. Ask if you could bring AirPods. Put your music on, put on a podcast. And I always say that whenever you go to the dentist, if you're a little bit anxious, wear the AirPods. You're going to be, or even over the ear, whatever they let you wear. You're going to feel so much more relaxed because you're going to be in your own little world. So good luck. You did not make a bad decision. It's the decisions that is best for you. And I can't wait to hear how it goes. And I'm sure it's going to go well. Someone just said I went to the dentist and got 2 fillings. Hey, I'm glad you did it. Get those fillings done. That's the thing. Fred Johnson, when I'm scrolling through. This is kind of cool. This new platform they have, I don't have to lose my spot. So I'm really just going down the list. So of the questions. What was I going to say? Oh, yeah. Getting the fillings done when they're small, so important, because when you push off, when you put it off, when you don't get fillings, you wait too long, they're just going to get bigger and bigger, and they could become needing a bigger filling or a crown, all more expensive stuff. So you did the right thing, getting what you needed to get done. Who you think it is? Oh, that's the name. I was like, wait, what am I reading? Okay, who you think it is this, or saying, heading into a dental hygienist program next fall. Congrats, who you think it is. Any advice you would give to a student for study practices or general advice? You got this. You worked hard to get in. You got in. That's the hardest part. You got in, right? The second hardest part will be taking your board exams, but don't even worry about that yet, because you got 2 to 4 years, depending on what your program is, of studying. Take your notes, save all your notes. That's good advice for dental hygiene school. Don't just take a test in one ear, out the other, like lots of us, myself, tended to do for like undergrad. I would take a test, I'd memorize it for the test, and then I'd forget about it. You don't really want to do that in dental hygiene school, because you need to remember all this stuff for your board exam. So it doesn't have to be right there, but keep it somewhere in the head, in the mind, right? So basically, don't throw away your notes, anything you used to study for your test for, because you're going to want to go back to those when board exams. Just think ahead for board exams, right? But you're going to be great. I'm so excited for you. Who you think this is? That's her username, if anyone wants to know why I keep saying that. And I can't wait to welcome you into this toothy community, this toothy industry of dental hygienists. Congratulations. That's a really, really awesome thing that you got in. You're going to do great. You're going to do so great. Someone just asked, you still at work? You must live on the West Coast. You all are 3 hours behind. Pack Jack forever. So no, funny enough, so if you're in the vertical, you might not see it. Here, let's see. Can I move there you go. Can you see that? A little bit in the vertical now? For the horizontal, you see it. It's my dental chair. Fun fact, this is my filming studio. This is not where I practice dental hygiene. This is just where I film YouTube videos. So I'm not at work. This is my home office. What's up? So it's really cool. I used to, I almost said long story short, but I tried not to say it, but you saw me pause and I was like, wait, what was it? I worked I had like a pilot situation thing for a TV show. And that's why the chair was here. And then the TV show ended up not getting aired. So now I have a chair. But it's great because I use it for YouTube videos. So it all works out, as they say. In India, it's 6:34 a.m. India, Khushbu Singh. Oh my goodness. Good morning in India. Can everyone tell me where they are from and what time it is over there? I love this. Thank you for telling me that. It reminds me like how amazing YouTube is, that not only are we all coming together to talk about teeth and dental health, which is so cool that this many people love teeth and dental health, to talk here live, right? But also that we're coming from all over. We're from everywhere. We're from India at 6:34 a.m. So where I am right now, well, that was 34 when it was 34. I'm trying to figure out the 34 because should we all be the same minutes? I don't know. I'm like, wait a second. Either way, it's 8. I am at 8:18 right now in the Midwest in Central Time. So 8:18 is where I am. So I'm thinking 6:34 a.m. I would think it'd be like 6:18 a.m. You know what I'm saying? Or obviously this was maybe a few minutes ago. So anytime, I don't know. I'm confused, but either way, time zones. Don't worry about that. That's not dental related. It's okay that I'm not perfect at that. Okay. Okay. So someone asked Oliver Gonzalez, have you ever had patients that have asthma attack? Not in my chair. Not yet. Let's hope never. I have patients with asthma, and depending on how severe it is, I make sure they have their inhaler. That's what they taught us to do in school. They take their inhaler out and they put it on the counter next to me. So I could grab it for them if needed. So if something did happen, we don't have to find it on their person. It's out on the counter. If there was a medical emergency with their asthma, the inhaler's right there. I'll give it to them. We'll be all good. So when it's people who have exercise-induced asthma, it just depends on the severity, on whether it needs to be out, because anxiety can induce it too. So, but anyway, for anyone, yeah, who has asthma, we don't play. We like safety first. Hi, Whitney. Samantha Stewart. Hello. Thank you for being here. She said, where are you from? I am from Chicago, Illinois. And you said, doing great tonight. Thank you so much. Thanks so much. Oh, wait. Maybe you're saying you're doing great tonight. You're not complimenting that I'm doing great. I just realized that could go either way. That's really funny. I'm like, oh, thank you. I'm doing great. I hope you're doing great too. I hope you're telling me that you're doing great and that we're both doing great. That would be great, right? Mr. Shadow Gaming, any advice for someone who has an upcoming dental appointment and has dental anxiety? Great question. So similar to the person who asked about their upcoming wisdom tooth appointment, my number one is headphones. Whether it's music, podcasts, white noise, pink noise, whatever kind of brown noise you want to listen to, there's all those different noises. Have you seen that when you're scrolling? Through white noise? Sorry, I'm trying to get... there's a lot of different noises. Crickets, whatever you want to listen to, put them in your ears. I mean, always ask your dental provider, depending on which kind of treatment you're having, we might want to be able to kind of talk to you in and out. So maybe even just one ear and keep the other one ready for us. Just it depends on the treatment. If I'm just doing, routine stuff, we're usually fine. But if it's a bigger procedure, they might want one ear. Anyway, that's my biggest thing. And then also letting them know this is dental anxiety that we're talking about. When you have dental anxiety, let them know. Don't try to hide it. I know I'm someone who would try to hide it if I was nervous about something. I know that about myself, but I really, being on the side of the clinician, being a provider, I can always help you more when you tell me what's wrong. You know what I mean? When someone's acting a little different, I can't figure out what's wrong. I don't know if they just had a bad day at work. I don't know if they just got in a fight with their partner. You know what I mean? We can't read your mind. So, but then if you tell me like, hey, sorry, I just have dental anxiety, then I'm like, okay, got you. I got you. Now we know what's going on. You know what I mean? So just let them know that you're a little nervous, and then we'll kind of get to the bottom of it and accommodate you for you, and, bring you to comfort, however, whatever that means for you. Honestly, this might sound silly, but it really helps. Weighted blankets are like a big deal for anxiety. They can help a lot. Obviously, you don't have to bring a weighted blanket, but if they have those lead aprons for the x-ray, for taking x-rays, you can ask them to lay a lead apron on you. I've had a few patients that like chef's kiss. They love that. So those are some tips. I hope it helps you. And I'm wishing you the best. And I'm so proud of you for going, because that's another thing. The hardest step is getting in the building, right? Once you're there, it really is always easier than you worried about. That's with everything in life, right? We worry ourselves and then we get there and then we're like, wow, it wasn't that bad actually. So you got this. It's going to be so worth it. Fred Johnson wants to be a doctor when he grows up. Go, Fred. I love it. Let's give Fred. I'm so excited for you, and I can't wait to see you. I don't know how old you are, but say it's 10 years, maybe 10 years until you're a doctor. I can't wait to see you up here on YouTube teaching me about all the facts you learned in school about whatever doctor you're going to be. I love that. I love that. Follow your dreams. Michelle, I've been watching your videos for a few years, and my oral health has her oral health has improved by leaps and bounds. I used to get 3s and 4s. Now I get 3s and 2s. So thank you for, oh my goodness. Thank you for doing, Michelle. Wait. Oh, sorry. It's Michael. Okay. We went from, okay. Michael Bontempo. Sorry. I was saying Michelle. Okay. Michael, thank you for telling me that. I am so, so, so happy to hear that. I mean, that's why I do what I do. Like, that is so cool. But thank you for thanking me. But I want to thank you for keeping up with your habits at home, right? Oral care is everything. Home care is everything. Habit forming, routine building. Another reason we were talking about the Better Mouth app earlier. It has to come from within. So you did that, Michael. So keep up the great work. Thank you for telling me that. Oh my goodness, Kobe says, thank you for your support, Kobe. From New York here, 7 to 9K for single one. I did the turkey tooth single implant, 4K with flight, 2-day hotel. Yet all good. Let's see. Doc was a German too. Okay. I'm trying to just decipher if you already had it done, or are you saying this is what you're going to do in the future? Either way, from New York here, one single one. I did a turkey tooth single implant, 4K with flight. All good. Hotel yet. All good. I'm thinking you already did it. Yeah, Doc was a German too. Okay, so you already did this. Okay, so that's good. If you know what, I know I made that turkey teeth video more recently about how you have to be very careful about going to Turkey for veneers, because a lot of times they are marketing and advertising veneers as crowns. So the reason a lot of people got a little concerned about that video, I'm not saying all dentists in Turkey are bad, not at all. Of course, there's amazing dentists in Turkey. I'm just saying there's a lot of companies right now, enough that the reason I made that video, so many companies, and I say companies because they're not always dental offices. They're these clinic companies. There's so many that I'm getting so many messages constantly every single day asking me, should I do turkey teeth? Should I do turkey teeth? So obviously they've made a big impact on social media. So it doesn't just happen in Turkey. There's other countries that do budget dental care, right? It's obviously not just Turkey, but that one, they are killing it with the ads. They're doing real good with their advertisement. And where that becomes a problem is when they're not all good clinics, So a lot of them are advertising falsely. They're saying they're giving patients veneers when they're actually giving them crowns. And there's a big, issue with that can be very damaging to your tooth when you don't need a crown. So it's a whole long thing. If you want to learn more about that controversy, you can type turkey teeth, teeth talk girl. That was a lot of T's. Turkey teeth, teeth talk girl in the YouTube search bar, and you can watch that full video of mine. But long story short, to my pal that just asked me or told me that he got them done, in Turkey, and everything's fine so far. I'm so happy to hear that. And then, of course, continue going to your dentist here. You said you were from New York, to make sure they can check everything and make sure everything's healthy with what you got done. Let's see. Samantha said, say hi. Hey, Samantha Stewart. You said, how are you doing tonight? I'm doing well. Thank you so much. I hope you're doing well as well. Catalytic converter. Please, how do I talk my dentist out of using the hooked, pointy metal scraper thing? Oh, no. Okay. Why are we trying to talk them out of it? So I'm thinking here, of course, I was so excited. I brought all this home care stuff, my baggie of home care, but I didn't bring any of my instruments. That's okay. Next time I will bring my instruments to show you, but I'm thinking you're talking about the Hook Explorer, the hooked pen, or the scraper. Maybe you're just talking about scalers. Either way, the reason they have to use them is to either explore and check for cavities if they're using the Explorer, and if they're using scalers, it's to remove the plaque and tartar and buildup from your teeth, the bad bacteria, so it's not sticking on your teeth, infecting your gums. So they're using it for a reason. I know you put, how do I talk them out of using it? If they're using it, it means they have to do it to best benefit your health. But if you're having pain, or I'm not sure the reason you don't want them to use it, but discuss that with them. Personally, ask your individual dentist, tell them what your concerns are so they can help you better find out what's going on with that. Erica is asking, is it harmful to your dental health if you floss only 3 to 4 times a week? I mean, that's, a very broad individual question, right? Some people need to floss 2 to 3 times a day. Some people are fine flossing once a day. So I wish I could give you a better answer, Erica. It is indicated, at least the American Dental Association recommends you floss and or clean between your teeth at least 1 time each day for a baseline oral health. Can some people maybe get away with not doing it every single day? If there's so many, it's such a multifactorial thing, diet, genetics, it's multifactorial. Like, there's so many, the saliva, the pH of your mouth, there's so many things that determine your dental health and how important it is that you brush and floss multiple times a day, or twice, or the bare minimum, or more than the bare minimum. You know what I mean? So long story short, I'm sorry, but that is something to definitely ask your individual dental provider. But the general rule of thumb is nothing's harmful if you're not doing it enough. You know what I mean? It's not going to hurt you, like in the sense of causing damage, but it could hurt in the long run if it's not protecting you against cavities and gum disease as much as if you were to do it once a day. Having said that, if you don't floss at all and your goal, you're like, I'm doing 0, I really want to do 3 to 4 times a week, that's my goal, I love that. We got to start somewhere, right? So it just depends, right? It depends on your specific scenario. If you're already doing once a day, I would never say to go down to 3 to 4 times a day. But if you're only doing 0 times a week anyway, of course, 3 to 4 times a day will help. Something's better than nothing. But the ideal is once a day. Danny said, thanks. Thank you for being here. Young West said, can you bottle up your energy and send me some? That was really nice. Sending love. Thank you so much for that kind comment. Okay, so Jay is asking, I feel like I'm doing pretty good going through these. I'm like really trying. Okay, I'll just keep going. Okay, having JI6V9Z, having a deep clean in May, and I'm not nervous about the pain. I'm nervous about it making my teeth loose that have some, when I click show, does something, I could have been clicking these. Oh, that's so good to know. Okay. Well, here it is. I'm nervous about it making my teeth loose that have some receding. They aren't loose, but just freaking out already. Please calm me down. Oh my goodness. I will calm you down, because getting a deep cleaning, if you need it, is the best thing you could possibly do for your dental health to help your teeth not get loose. You know what I'm saying? Oh no, I just lost it. I know you could all see it, but where did he go? Where did he go? I'm answering your question. You're like, calm me down. And here I am freaking out about, I can't find where your question. I know you guys could see it, but I can't see it, which is so funny. That's right. Okay. I'll find it later. I'm going to answer the question. So here's the thing. When you get a deep cleaning because you need it, it's because you need it, right? Because there's plaque and tartar below your gum line. So don't worry about it making your teeth loose, because the thing is, your teeth are going to get loose if you don't get the deep cleaning. I'm not saying you individually. I'm just saying in general. When people put off getting teeth cleanings, specifically deep cleaning, periodontal maintenance, non-surgical periodontal treatment, scaling and root planing, whatever you want to call it, when you need this deeper cleaning, it's because there's plaque and tartar below your gum line. Now, when this plaque and tartar gets removed with that deep cleaning, now it's giving your gums a chance to heal. We removed all that bad bacteria from your gums that's eating away at your bone. So if you were to leave that bad bacteria there, it would keep eating away at your bone, and then your teeth would get loose, right? But now that we're removing it, now it's giving your teeth such a good chance for not getting loose in the future. So you're doing the right thing. You're doing the right thing. People get really nervous because they're like, what if my teeth feel loose after, because the tartar was holding them in? You don't want tartar holding them in. I promise you. Tartar is bad, unhealthy, bad bacteria. It's kind of like when people say they want to continue smoking because they're staying thin. I know it's a weird analogy. I'm jumping to kind of a different thought process, but people are like, I smoke because I don't want to quit because then I'm not going to be thin. It's like, no, here's the thing. Smoking is so bad. You know what I mean? So it's kind of that same thing. People are like, I don't want to get that deep cleaning because my teeth might get loose. That small chance that your teeth might feel loose, they're going to be healthier in the long run because that gum can build itself back up. And if it can't, they will talk to you about other issues, or they would talk to you about other procedures that you might need, gum grafts, bone grafts. But if they haven't even mentioned that to you yet, it's very unlikely that they think that would happen. So if you're stressed about it, ask them, be like, do you predict my teeth are going to be loose after this, in a healthy way, but you get my point. If you didn't do it, they will absolutely get loose at some point in life, because that tartar will keep eating it. But doing that deep cleaning now is going to help you so much in the long run. Again, this is general advice. To every situation and every individual is going to be different, but you got this. Someone said white teeth, healthy teeth. Agree. Well, here's the thing. Fun fact about white teeth, healthy teeth. Yellow is my favorite color. That is funny. I never thought about that as a dental hygienist, like yellow teeth. Yellow is my favorite color. I don't know. Anyway, white teeth do not actually equal healthy teeth. There are a lot of people who their front teeth look really nice and white and perfect, healthy, but the back teeth, they got all these cavities, fillings, gum disease. So don't let white teeth fool you. I know plenty of people they don't have super white teeth. They're like maybe even like shades dark, yellowish, brownish, but not one cavity. You know what I mean? It's all about cavities. It's all about gum disease. It's not about aesthetics with health. But if you got both, we love both, right? Okay. Michael, I really read that to make sure I didn't say Michelle. I was like, is it Michael or Michelle? It's hard when there's no space between the teeth, or the teeth. No space between the name. Wow, I really am into dental, huh? Okay, Michael. Hello, Whitney. I have a question. I've been going to the same dental office for the past 34 years. Ownership changed. And then it says and the rest of the question isn't there. So sorry to hear this. I don't see the rest of the question, but maybe when I keep scrolling down, I'll see more about what's going on there. Someone asked, have I ever been to Colorado? Yes. I feel like I said that very Chicagoan. Colorado. I'm like literally Chicago. Yes, I have family there, so I've been there plenty of times to visit my family. Colorado Springs, Manitou Springs, Denver. I've been up in the mountain towns. I'm not like a skier really. I like skied a couple times in my life, but what is it? Keystone, Breckenridge. Trying to think of all the little ski towns I've been to. Monarch, that ski town, ski resort. Yes, the hot springs, Garden of the Gods. Am I impressing you that I've been there? So yes, love it. I think it's beautiful. I will say I love it. I think it's beautiful, but I do have it makes me my sinuses. I gotta have a humidifier in the room with me. You know what I'm saying? With that dryness. But overall, beautiful state. Best way to clean your night guard. Yes, someone just said, Jennifer, is this live? It's live. We're live. Ask me your questions. I'm scrolling through, so I'm going in order. Jilly, Jilly asked best way to clean your night guard. So I do have a night guard video. Just type in night guard teeth talk girl in the YouTube comment or in the YouTube comments. What am I saying? In the YouTube search bar. And you will, I'm like trying to show you my ponytail. Wow, I'm getting distracted. You can tell. Okay. And that will tell you exactly how to clean it. But I will just give you a quick rundown of it's a very controversial thing, believe it or not. Why does everything have to be so controversial? Dental professionals tend to argue over the best way to clean a night guard. So my best, safest answer, and true, what I tell my own patients is ask the dentist who made it for you, right? So I could tell you what I do, and this is what I do because this is what my dentist who made it for me told me to do for this one. But just remember, there's different materials that night guards can be made of. So the night guard you have might have slightly different suggestions, recommendations, instructions on how to keep it clean at home. So always ask. But I would say a general rule of thumb is to not use toothpaste. Usually that's a little too abrasive. They usually say soap and water instead of toothpaste, which kind of freaks people out. But if you brush, for me, what I do is, this is controversial. Some people say don't do this, so ask your dentist. But I do brush mine with an extra soft bristled toothbrush because that's the way I get all that soap out of it, because you don't want to be tasting soap. Some people like to use those ultrasonic pods, whatever you want to call them, where it kind of vibrates it all off. Some people love those. Some people hate those because they say it can etch away at your, so just ask the dentist who made it for you what they think is best. But what I personally do, like I said, is that for mine, but again, they're all made of different materials. I'm like holding in a sneeze. Sorry. I'm like about to sneeze. Am I about to sneeze? No. Okay. Went away. Gesundheit. Okay. I do use soap and water for mine every day, and then once or twice a week, I soak it in with a retainer tablet. I don't usually use the ultrasonic myself. I use the ultrasonic because I have one as just like my cup in the bathroom because it looks nice. It's like really like a good looking thing to have on the counter. It's pretty. So that's what I do. Sorry, I really feel like I'm gonna sneeze. Okay, I'm okay. Okay. Any advice? Sporty. Oh, sporty. That's a cool way to spell sporty. Oh, I forgot I could show these. Sporty. Any advice reaching to the back of your mouth when brushing? I gag easily. Okay. So yes, slowly get back there. Don't push it back there right away. Start in the front, slowly see how far you can make it back there. Don't force it. Don't force it. Another thing is breathing through your nose. Really focusing on breathing through your nose. Another thing is wiggling your toes. Really focus on like wiggling one toe at a time. I know that sounds so weird, but it's not just psychological. It's a physiological thing in your brain. If your brain's focused on wiggling your toes, you can get back there better without the gag to happen. I do have a how to tongue scrape video without gagging, which if you want to search again, how to tongue scrape teeth talk girl, put that all in your YouTube search and the tongue scraping video will come up. It'll talk about how not to gag, and I have more gagging tips in that. So I hope that helps you. Omega, how do I know if there's a cavity under a root canal cap when there's no feeling? Your dentist. So this one was tricky because, here's the thing. You would say an x-ray, most of the time an x-ray. However, sometimes depending on what kind of cap it is, a crown, if it's a porcelain fused to metal crown, if it's a full ceramic crown, depending on how the crown shows up on the x-ray, sometimes we can't see it on the x-ray either. So we have to physically feel with our Explorer. We were talking about the Explorer earlier, the Hook Explorer, the little hook. We'll try and feel under there to feel if there's any signs of decay. So it's going to your dentist regularly to check. So hopefully that kind of helps. You said root canal cap, and I'm thinking, like crown. But yeah, you're not going to feel it. That's the stuff. Once you have a root canal, You're not gonna feel that tooth. Will you feel it if you have a gum infection around it? Sure. But if the tooth itself has a reoccurring infection, if for whatever reason you have a hunch that something's off, when you've already had a root canal, you're usually going to want to see an endodontist. So that's the root canal specialist. They can help you really decipher and be a detective on what's going on there. Someone just asked, guess what? I have props for this. Thank you for asking. You didn't know what props I have, so this was just happenstance, but I'm still going to thank you. Is regular floss better than the floss pick? We have props. That's so fun with Danny. Okay, so the short answer, it's like yes and no, right? So the short answer is no. Whatever you use, as long as you're using it correctly, is good. As long as you're using correctly and every single day. We like it. If you are using regular floss, traditional string floss every single day with good technique, or if you're using a floss pick every single day with good technique, you should be fine, right? However, if you're someone who's using regular string floss every single day and you're using it wrong, you're doing something wrong because it's hard, you have manual dexterity issues, you just don't like it. If it's easier for you to use this every day, we much rather you use this correctly than use this wrong. Does that make sense? So hopefully that makes sense. I think it makes sense. Having said that, the best of both worlds is always like the most optimal, because whatever you're doing wrong here, you can fix with here. Whatever you're doing wrong here, you can fix with here. So I like to use these ones after breakfast, and I like to use this one every single night before bed. Do you have to do that? No, but I'm just giving you general tips and tricks. But always ask your personal dentist or your personal dental hygienist what's best for your individual mouth. One more thing on this question. If you are using a floss pick, it is best paired with a water flosser. I love when someone uses a water pick and a water flosser, both. That's like so amazing because you're doing both, right? Because these are really, really good for preventing cavities. They're pretty good for preventing gums disease too, if you use them right, but user error usually kind of like takes over sometimes because it's hard to bend these sometimes. Not all of these. These ones are actually really easy to bend, but some aren't. So it just depends. So if you're doing a water flosser to keep your gums healthy and you're doing a floss pick to keep your teeth healthy, I'm in. Wow, those are really white teeth. Good job, I guess. Thank you, Sloppy Susie. My goodness. Okay. Okay. This one is, okay. So you said the hooked metal tool against my teeth is like nails on a chalkboard in my mouth. Help. Oh no. Okay. So yeah, that's again, when it's an individual situation, when you're at the dentist and something is making you uncomfortable, such as the hooked metal tool, you got to really tell them so they can help determine why it's hurting you. Or you said nails on a chalkboard. Maybe it's the sounds. Sounds are hard. The sounds we can't do too much about, other than again bringing your own music to play in your ears. But I know sometimes the vibration, you could feel it in your body, so it's kind of like, ee. So definitely talk with your individual dental provider to see. That's my best thing, is communication is key. Communication is everything when we're trying to figure out how to help you individually. Someone asked, should I get an electric toothbrush? Look, I have a prop. I'm so happy I brought another prop. So yes, here's the thing. Regular toothbrushes versus electric toothbrushes. What's the diff? So the difference is, when you're using a regular toothbrush, can you do a good job? Yes. Will you do a good job? Unknown. That's the thing. There's more user error with the regular toothbrush. When you have an electric toothbrush, it does the work for you. Whether it's one like this that spins. Can you see the spin? You could probably hear it. Whether it spins or whether it vibrates, when it kind of looks like this one, but it vibrates, whichever one, electric toothbrushes do the work for you. So there's less chance of user error. So I always say, yes, it can only help. It can't hurt to get an electric toothbrush. But if you're someone who's like tight, pressed for money, and you're like, I'm not about to buy anything, even though that some of them are, very affordable nowadays. They're, depending on your budget, there are electric toothbrushes where you really do get a good bang for your buck. I do have a storefront. If you go to any YouTube video of mine, in the description box, you could go to my storefront. It says like view my storefront, and I have these ones listed in there. So you can always check those out. Wow, look how it's like you can really see it. Hold on, let's turn it on. Wow. Look at this camera. It is like really focusing. Okay, that was exciting. Anyway, so you all get me, right? That makes sense? Regular, electric, both great if you use them properly. It's harder to use a regular one properly because you have to really, really, really do all the motions perfectly. This electric one, you just guide it along from tooth to tooth and it does the work for you. Of course, you want to angle it 45 degrees toward your gums. And then, oh, there it is. There we go. Okay. We were trying to figure that out. Thank you so much to put that in there. I know Alex is helping me out behind the scenes. Thank you, Al. Oh, it went away. Well, it was there. My storefront. This one, same thing. You have to hold it 45 degrees toward the gums, but you have to do like gentle circles. It's a constant making sure you're not missing anything. You're less likely to miss spots with an electric toothbrush. Anyway, I have all the products I use and recommend in that storefront of mine. And if you're not, whether it's here or whether it's here, whichever one you're looking at, it's in the description box of every single one of my videos. Okay. Let's see. What else? Where did we go? What's the best thing to do for chipped teeth? So it depends. Well, you know what came to my mind right away is if you're going to get them fixed, first figure out why it happened. Why did you chip your teeth? Because was it clenching or grinding? Because that's like a very, very high prevalence of why people chip their teeth. Are you banging on those teeth at night? Because if you're going to get them fixed, it's probably just going to happen again. So I would highly recommend a night guard if you think it's due to clenching or grinding. If your jaw is ever hurting in the morning. But yeah, getting them fixed, whether it's bonding, fillings, if they're really extreme, maybe you need some veneers or crowns, but definitely figure out a game plan for it to not happen again before you get them all fixed. And then they're just going to get ruined again if you're clenching or grinding at night. So hopefully that helps. Definitely look into night guards. And then I know a lot of people, I have a video coming out soon about like, are night guards the answer? Because a lot of people are kind of, maybe this is someone's question in the future, or when I scroll through the rest of this list, but maybe someone, you've heard like night guards are a scam, something like that. Here's the thing. Night guards are great to protect your teeth. Are they going to stop you from clenching and grinding? Probably not. So if you can find the causes why you're clenching and grinding, if that's even why your teeth are getting chipped, but until you find the cause, whether that's stress, whether that's orthodontics, maybe your teeth are a little malpositioned, maybe your bite is off, maybe your jaw is overcompensating because of, whether it's airway issues, maybe, you didn't realize you have sleep apnea, stuff like that, that can all cause clenching and grinding. So definitely look into why you might be clenching and grinding if that's what's chipping your teeth. But until then, if you're going to get them fixed, make sure you wear a night guard to protect them. Hopefully that helps. But if it's stress, let me tell you, stress is so hard. I clench and grind when I'm stressed, especially like if I have exams coming up. I'm in school right now, working on my doctorate, which I'm seeing right here. Thank you. I answered half this question. How was the Florida trip and how was school? School is stressful. Thank you for asking, but it's good. It's going to be worth it. But anyway, yeah, that's my thing about night guards, tying this back to the chipped tooth question. I'm always wearing my night guard during school because I can't fix the root cause. I'm stressed. I'm in school. I'm going to be clenching. So hope that kind of helps answer your question, and I'm wishing you the best with, hopefully figuring out your plan of action. Okay. Someone asked, hello, or hey, ma'am, I have been neglecting my dental health for years. I also deal with anxiety, and now I have lots of cavities, especially my front teeth, and I'm not confident to even talk. It's really serious. I'm so sorry. Okay, so here's the thing. No, I have lots of cavities. This is what I tell my patients, because my first thing would say, if you can get to a dental office, get to a dental office. A lot of, new patients that come to our office will say things like this to me, like, hey, I'm here, but I'm embarrassed for you to even look at my teeth. And I'm like, listen, don't be embarrassed. This is my job, and I can't wait to bring your teeth back to health. And that is how all of us dental providers, we are just so excited to fix your teeth and bring you to health. So don't ever be embarrassed. Don't worry about not being confident. if you go to the dentist, we will get you back to confidence and we will get you back to health. Now, I know finances are always a big concern. Like with 95% of patients will say finances are a concern. So if you are part of the 95%, there are dental schools, dental hygiene schools in your area. There are low-income clinics, if you qualify for certain clinics to get work done. So definitely look into affordable ways. And also knowing that you don't need dental in the US, you don't need dental insurance to go to the dentist. So anyone can go to the dentist and you could pay cash. I know that sounds easier said than done. People are like, yeah, well, I don't have the cash. So, obviously there are credit card financing options. There are like Care Credit where you can do 12 months, 0%, financing. So there are options. Some offices even have like payment plans in office for non-insured. So call around and find an office, because once you get into an office, we're not judging you. We're here to help you. We will work with you in your anxiety, and we want to bring your teeth to health, and we're all going to be so happy at the end. So you got this, and I'm rooting for you, and I can't wait for you to get to that next step and make that appointment. Okay. Is this Paolo or Paulo? Okay. My friend here, 2523, still waiting for my dental hygiene program application. Okay. We're waiting, but we're going to be waiting with you. We're sending you all the toothy vibes, positive toothy vibes. And I can't wait for you to join this toothy community as a dental hygienist program application. You got this. I can't wait to talk with you soon when you're a hygienist. Uh-oh. Tim, we got a question. Thank you so much for your support again, Tim. That's really nice. I forgot to mention, I also have to get a bone graft after the wisdom teeth removal. Okay, cool. What is that like? Also, I only have 3 wisdom teeth, LL, not 4. Yes, because that's what I was wondering. I was like, 3, not 4. So you just don't have the 4th. That's great. Buy 3, get 1 free, right? Okay, I'll let you know on your next live if I start. You're going to survive. You're so funny. Stop. You're going to be great. You're going to be great. Okay, so here's the thing. I only have 3 weeks. Okay, so yes, bone graft is great. That actually is going to make the healing process so much better for you, because now you're like, I don't want to say a lot of people, but sometimes, like, I'm not worried about you getting your wisdom teeth out without without the fully going under. You're going to be great. But I'm just saying, when you recover, when you go home, sometimes if you need a bone graft and you say no to a bone graft, that can be a little harder, more difficult of a recovery, because you obviously you have a little less bone. There's going to be more of a divot pocket situation. So no, it's so good. It's going to make things better, if anything, in the long run for you. So I'm very glad to see that. And thank you again for your support. I truly appreciate it. We're all rooting for you, Tim. You got this. Greetings from Ridgecrest, California. Greetings. Aviation drummer. Okay. You know that I played the drums in high school and college and all grade school too, but in college I had a scholarship. Fun fact. I played the timpani in the concert band. Greetings. Ma'am, what's one dental secret that can change someone's life if they start today? It's simple. Brushing and flossing every single day. Never skipping a day. Can't skip a day. That is the secret. That is the secret. It's not even a secret. It's just routine is key. Staying motivated, keeping up with good habits, that is key. It would change everyone's life if they never skipped a day of brushing and flossing. That's it. $2, a $1 toothbrush and a $1 strand of floss will change your life. And if you want to get an electric one, can only help, can't hurt, right? Like we talked about earlier. Okay, I love that. That's a very good question. And that is my confident answer. I'm like thinking about all these other things I could say. No, that is number 1. Oh, that's very nice. You're very nice. Thank you. I'm a dental hygienist. Thank you so much. You're so nice. John Smith. Thank you. Okay. Yes. Thank you. Samantha asked, what app do you use for tracking your daily routine? It is called Better Mouth, the Better Mouth app. I'll write that somewhere in here if we can write it. Let me put it in here. So Better Mouth right now, it is only in the Apple Store. The App Store, Apple's App Store. It's for iPhones right now. But the Android, as someone asked earlier, is in the making. it's being tested and doing all the things to make sure it'll work on Android. So that's exciting. But if you do have an Android and you're interested in the Better Mouth app, you go to bettermouth.com and it will, there it is, bettermouth.com, and it will bring you to the wait list if you have an Android. But if you have an iPhone, you could download it right now and it's free. There's a free version. That's the version I use. Yeah. Thank you for asking. What tongue scraper? Okay, so Chummy asks, what tongue scraper do you find the most effective? Honestly, it's the one you're going to use. That's what I say for toothpaste. That's what I say for everything. The one that you like and you're going to use is the one that's going to be most effective because you're going to use it. Never try to force yourself to use something that you hate. Find the product that you like. So usually there's either going to be plastic ones or there's going to be metal ones. I don't have a metal one here, but here's a plastic one. So the plastic ones, I will say you have to change these out every 3 months, just like you change out your toothbrush or your toothbrush head. The metal ones last kind of like for life, depending on, check the instructions, because you could put them in the dishwasher. You can like wash them. So the metal ones last longer, but yeah, whichever one you like. Ever consider dental school? Absolutely. DIKTAR. I did consider dental school almost my whole childhood. And, I got to my undergrad. I was doing my pre-dental track during my bachelor's degree, and I was shadowing and observing dentists. And I always found myself looking in the other room, and I was like, what are they doing in that room? And I'd be like, what are they doing in that room? I was always watching the dental hygienist. Long story short, here we are. I found out that I was more passionate about prevention than I was restoration. Yes, restoration is amazing. It's so amazing how dentists can fix a broken tooth, bring a tooth back to life, basically, right? Whereas I was just kind of like, I want to prevent these teeth from ever getting broken. You know what I mean? I want to prevent these gums from ever getting infected. The prevention was so interesting. So I was like, you know what? Let's just try dental hygiene school instead. So I never applied to dental school. Just went to dental. I finished my bachelor's degree and I was like, let's apply to dental hygiene school. So I went to dental hygiene school and I really thought like, I'll do this for a while. I'll get it out of my system. Then I'll go to dental school. But no. I did dental hygiene school. I never looked back. I fell in love with it. I am furthering my education right now. I got my bachelor's a couple years ago, oh my gosh, I got my master's, my master's a couple years ago, and now I'm working on my doctorate, but it's all in health science, health communication, ways to be a better communicator as a dental hygienist, and more evidence-based, better hygienist in academia. Not clinically, obviously, but in academia. So I'm doing everything I can I almost wanted to make like a better mouth, better me, better. I don't know. There's a lot of things that have the word better in it because I'm just seeing this too. Thank you for asking. I'm seeing this too, and I got distracted. I'm so close to a 500-day streak, and I'm like, you're talking about better mouth. So yes, I'm bettering my education as I'm bettering my mouth with the Better Mouth app. I love this. I did not expect to talk about Better Mouth as much. Thank you all for asking so much about it. I really, really do love that app. I'm so honored and happy to be the oral health advisor. Say hi to me. Hello, Samantha. How are you? I've seen videos where it hurts really bad. You get loopy. Shoot, what was that one? What were we talking about there? Remind me. Someone said, love that yellow. Thank you. I love the yellow too. Yellows, it represents, okay, so when you get yellow roses, it represents friendship, right? I love that. I just think like yellow friendship roses, just so nice. And of course, I love yellow because it's just like a happy color. It's sunshine. Who doesn't like sunshine and rainbows? I sure do. I'm trying to make my hair to match it. I'm putting yellow in my hair. No, it's blonde, but oh my God, I forgot I put a yellow. Okay, thank you. I know it's been an hour already, but I'm going to go a little longer because I really want to get through as many of these as I can before I fall asleep because I'm getting really tired. Just kidding. I'm not tired. Actually, my head hurts. You know what's funny? I always say headache. I always thought it was headache, but it's headache. It's my fun fact. Sometimes when I record videos and like if I'm talking about like dental something and, say we're talking about clenching or grinding and I'm like, you could wake up with a headache. And I'm like, oh, I said headache. So I have to like re-say that line. Like, you could wake up with a headache. Well, now you all know. Or work really hard to say that word, right? or those two words. Anyway, yeah, I'm not tired. I just got a little headache. I think it's because of so much fresh air. Okay. I'm so excited. I'm getting through. I love this. I love this so much talking with you all. This is so nice. Can I create own toothpaste that contains xylitol? Okay, Bernard asking me, or Bernard. I had an uncle Bernard. I know it's usually Bernard, but he was Bernard. That's how he pronounced it. Okay. Can I create an own toothpaste that contains xylitol, hydrogen peroxide, 3% baking soda, clove oil, coconut oil, micro hydroxyapatite, and use it on a daily basis 2 times a day? Here's the thing. I'm listening to everything you're saying. I don't know where you're going to get your hands on some hydroxyapatite. That's not something you just like buy at the store. That's a very like highly formulated, difficult thing to get your hands on. But all this to say, even if you were to get your hands on all this, because I feel like you'd have to buy it in huge bulk, hydroxyapatite. Yes, you can get baking soda. Yes, you can get clove oil. Yes, you can get xylitol, all this stuff. Hydrogen peroxide, but hydroxyapatite, I'm not for the micro hydroxyapatite. There's not many studies showing that that's effective for remineralization. If you're going to do hydroxyapatite, you want nano-sized particles. And having said that, we're not even positive on how effective those are, right? When you look at, of course, fluoride versus nanohydroxyapatite, when you look at how they handle acidic conditions, which acidic conditions in your mouth is what leads to cavities. Say this is hydroxyapatite. They can't handle those acidic conditions as well as fluoride can by 1 pH point. So it's like 4.5 to 5.5. And that 1 pH point can make a huge difference in someone's mouth. If there's someone who's cavity prone with acidic saliva. So I'm not for nanohydroxyapatite that much, but it's something's better than nothing if you're not using fluoride. But I absolutely do not like the micro. So I wouldn't do micro. I would do nano if you could somehow get but even that, you still need 10% concentration. For the limited studies we have, it has to be 10%. And most of the stuff you can maybe get your hands on is going to be like 2 or 3%. So I wouldn't, if it's something you just want to have fun with, like on the side, but I wouldn't replace a fluoride toothpaste with this. But nothing in there is looking like horrible to me. I don't know too much about clove oil, honestly, regarding your dental health. I wouldn't even add that in there. But if you just want to do some hydrogen peroxide baking soda, but be careful with the hydrogen peroxide as well. This is a real loaded question because this is like, there's so much chemistry involved. I'm happy to discuss this more, but it's this, I could spend a whole half hour, 45 minutes talking about this question. So I'm like, you're making my wheels turn, like thinking about a video to do a whole long form video on this. But yeah, I wouldn't. I always say, long story short, I keep saying that, use something that you know is going to be effective and something that's gone through the regulation processes. It has been tested for safety and efficacy, and that's going to be something that you buy at the store. You know what I mean? If you want to have fun and try and do something like this, I would never replace your toothpaste with it. And I would always talk with your individual dentist and or dental hygienist about what you're using to brush your teeth, because they will be the ones to best determine what's best for your individual mouth. But hopefully I gave you some insight there. But yeah. Okay. And if you want to learn more about micro versus nano, type in hydroxyapatite teeth talk girl and all my hydroxyapatite videos will pop up. I hope this helps you. Can you provide tips to freshen breath? How to limit bad breath? Yes. So the first 2 things for bad breath, Erica, number 1, tongue scraping. A lot of people do not scrape their tongue. If you're struggling with bad breath, or if you just want to know in the future in case you run into any bad breath issues, I keep noticing there's like a box. It's a box of masks. It's those Be Sure masks. I love those so much. I keep feeling like it looks like top of my head. Anyway, that's a box of masks. That's not my head. Or did I say masks? Yeah, gloves. The gloves are under it, the Ansel gloves. And then the spit blocker. I got all my things. But no, that's so funny. I'm like, that's not my hair. Okay, I got distracted again. Sorry. The tongue scraper is number 1. It's like 85 to 95% of bad breath bacteria is found on your tongue. So if you scrape it off with a tongue scraper, it will help so much. I recommend at least once a day. I do the morning and at night. I do twice a day. If the tongue scraper doesn't work work for you. The second thing you got to think about, are you flossing correctly and have you had a professional cleaning in the last 6 months? Another reason bad breath happens is because there's tartar below the gum line or there's just gunk between your teeth. So flossing is the number 2 cause of bad breath. People aren't flossing enough, or maybe they haven't had a cleaning in a while and that stuff needs to be professionally removed from your teeth. And then you could keep it at bay by flossing every day. So tongue scraper, flossing, and a professional teeth cleaning. If all that doesn't work, you're still having bad breath, I would ask your dentist, like, are there any signs of gum disease? Are there any signs of tooth decay? Is there anything in my mouth that can be causing bad breath? And if they say no, absolutely not, your teeth are great, your gums are healthy, then we got to look in the back of the throat, because maybe you got tonsil stones. People that get tonsil stones oftentimes are people who maybe had like strep throat a lot as a kid, or have postnasal drip, lots of allergies. If you have sinus issues, talk with your ENT, an ear, nose, throat doctor, and or an allergist, and ask them, like, something going on in the back of my throat. I get this bad breath. The dentist said I was fine. You always want to check with the dentist first. Dentist said I was fine. Now I'm here to talk to the ENT or the allergist. Do I have any bad breath coming from my throat? If they say yes, handle it from there. If they say no, your throat looks great, you don't have postnasal drip, you don't have allergies, you don't have any tonsil stones, your next result is a gastroenterologist, a GI doctor. So talk with your primary care, whoever you need to get to a GI doctor. Maybe you got some weird bacteria going on in your tummy and it's coming up. You got some acid reflux, you got something, there's a bad taste coming from your stomach. So that was my comprehensive answer. I was kind of proud of that, but that makes sense, right? So first check with the teeth, the gums, the tongue, everything in your mouth. If that fixes it, great. If that doesn't, now we check the throat. We're checking with an allergist. We're checking with an ENT. Are there tonsil stones? Is there something going on? And if that's not it either, then we check the stomach. So, acid reflux, stuff like that can also contribute to tonsil stone, just a bunch of stuff. So I hope that helps you. And yeah, that's the biggest thing. And then I'm talking about chronic, right? If we're talking about chronic bad breath, but if you are like, no, I just like get bad breath after I eat garlic, you know what I mean? Obviously there's going to be foods that cause bad breath. And of course, if you're not able to brush and floss, there are a bunch of, like right away, if you're out and about at lunch, at dinner, bring some floss picks in your purse or bag. There's like some, breath sprays that are made by some of the big brands, the big toothpaste and brands and stuff like that. You could find in the dental aisle, some of those mouth sprays, chewing xylitol gum, sucking on xylitol mints, any kind of sugar-free gum or mints is going to help after you eat stinky foods, right? Anything to neutralize the pH in your mouth and stimulate saliva will help so much. Megan, hello. Where are you from? I'm from Chicago, Samantha. Who you think this is? Okay, wait a second. I just been accepted. You, yes, we were like congratsing you. Yes, I was like, I remember you. Who you think this? Any advice you would for student? Oh yeah. We talked about this. Maybe this was just another formulation of you asking the question, but we talked about it. Keep all your notes. You got this. They are quite a few intense years. I was actually just talking about this. We were laughing. I was trying to remember my timeline. I was like, what was I up to in dental hygiene school? And I remember like things and I'm like, I can't remember my day. Like, what was I doing like after school? And I was like, oh, I was always at school. Cause like during the day you're in class and at night for me, I was in clinic. So like, I feel like I was just always at that school. So it's just intense because you're like always there, but it's so worth it and you're going to be great. Just save all your notes. So you're not like bombarded when boards come and you're like, whoa, I have to remember all this. Just don't let it go one ear out the other. Let it kind of stay in the brain somewhere, everything you learn, and you're going to be great. I'm so excited for you. My front tooth has been chipped since forever. I'm afraid, but I need it fixed. What's your recommendation? So here's the thing. You got this. I feel like you make that appointment. Don't be afraid because like I was saying earlier to someone else, we are so happy to help you. Once you make that dental appointment, I know a lot of people are nervous. They feel judged or they're just nervous. Like, I have this chipped tooth. Like, I've learned to live with it. Do I even want to fix it? So, go there and ask them, is this something that should be fixed? Sometimes, if it's not, if it's a small little chip, little microchip, no problem. Some dentists will be like, we'll just watch it. If it's not bothering you, we'll smooth it out. Maybe they'll smooth it out for you. But if they're like, hold on, this is turning into a cavity, that's when we need. So definitely get it monitored. Ask your dentist what they think you should do. That's my recommendation is ask your dentist what they think you should do for your individual mouth because every chip is a little different, but you got this. How is actually an overbite? Or my upper two teeth are big? Please tell me. So, I'm not exactly sure. So, I think you're asking like, do I have an overbite or are my upper teeth just too big? Does it look like an overbite? But I'm thinking, I'm not sure the question, but my best advice is if you're concerned about an overbite or an underbite or any kind of bite issues, the type of dental provider you'd want to talk to the most on that for your individual case, because again, it's hard without x-rays. It's hard without me seeing your teeth. I can't see this specific scenario, but if you've talked to your dentist already and you're like, I still don't have answers, see a orthodontist. Orthodontists are specialists in making your teeth look how they're supposed to look and I don't want to say geometry and physics of how they're supposed to move, right? So they will let you know if it really is a size issue or if maybe it's just a bite issue. Either way, I don't, which is better? It depends. It depends what your goals are. So, but no, that's a good, interesting question. Someone asked, what about people who don't have a ride to those appointments? So if we're talking about dental appointments, right, we're talking about how finances can be an issue. And of course, access to care is a huge issue. If you can't get to your dental appointment, it's a 3-hour walk. That's not going to help. So no, that's a great question. And that is definitely I want to say a geographic regional question, because not only is every state going to be different, but every town is going to be different on what resources the town offers. Of course, if you are able to fund it, of course, there's like Uber, Lyft, those types of things. But if it's someone who can't fund it and there's no bus near them either, in a rural, the city is always easier, right? Because, I'm answering a question that's not on there. Wait, where'd it go? Where'd this one come from? Okay, well, I was asking, I'll keep answering. I'll keep answering the question I don't know where this one came from. Okay, but people don't get to the ride. Look at the resources in your area. First, look at your state. If it's a financial issue, there are resources. So look at your state and then look at your county and see what kind of ways to get to the dentist are permitted under maybe if we're working with insurance or if we're working with different public health type initiatives and see what's in the area. But I wish I could give a broad answer, but every single town is so different, even within Chicagoland, So again, cities are easier because there's usually buses, but when it's rural, that can be challenging. So definitely look into the resources on your public health website. This question that I don't know where it came from, but here it is. Best thing for cutting down dry mouth at night. Does a humidifier help while sleeping? That is a great solution. I don't want to say solution, but a great thing to do on your list of things that will help with dry mouth. Yes, we love a humidifier. I think every healthcare provider is always like, that's great as long as it's clean, right? You never want to use a dirty humidifier, keep it clean. Humidifiers are great. Another thing, dry mouth, there are a lot of dry mouth products out there. There's toothpastes, there's mouthwashes that you can do right before bed. You swish with them. It's like a very thick, viscous mouthwash. But look for the dry mouth products. I have a dry mouth video. If you look dry mouth teeth talk girl, if you search dry mouth teeth talk girl on YouTube, my dry mouth video will pop up, and I have a bunch of products that I recommend in the description box. So if you want to find specific products, there's these little melts. They're like made of xylitol. You could put them in the back, like in your, like between your cheek and between your gums, like back there. And you could put that in your cheek at night and it like kind of sticks and then you go to sleep. And like a lot of people, I know people who are dealing with cancer treatments, often have really, really extreme dry mouth. And I know those little things help a lot of people. Those little xyli melts, I believe they're called. Again, look in the description box of my dry mouth video and all my products will be listed. But yeah, we love a humidifier. Okay. I have time for a few more. Okay. This one, yes. What do you think of xylitol gum? I think it's wonderful. I love anything that will help stimulate saliva and help neutralize the pH of your mouth after meals. It can always help. I love xylitol gum, xylitol mints, xylitol spray. You know, if you don't want to ever over chew gum because that could mess with your jaw. You don't want to chew too much, but it is pretty helpful. I love your channel. That is so nice of you. Thank you so much for being here. It truly, truly means more than you know. This one, honestly, do I have ADHD? Honestly, I've never been tested, but it really is a lot of my this is like a personal question, but I'm answering it. I don't care. It's fine. A lot of my family members have been tested and do have it. So it's probably highly likely because it could be genetic, right? But I've never been tested, but I function pretty well. Obviously, I go on like little like tangents where I'm like, you know, I could probably benefit from figuring that out to not go on tangents, but I feel like it makes me who I am, you know? It hasn't like hurt me too much in my professional life of going on tangents, you know, that's my biggest thing. But everything else, I feel like I'm a pretty good worker and I really stick to the task at hand and I'm like, blah, 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 blah. So maybe not. I don't know. One day I'll probably get tested just to see, but I'm okay for now. The oral cancer screening video you did recently was one of my favorites. So important. Thank you so much. And I love how you spell favorite because that is so cute. I love the U. Patsy knows what I'm talking about. I love, like, we both talk about this all the time, like UK versus US. Just the little differences are so cool to me. I love different cultures and like how things all come together. Anyway, favorite. Yes. But thank you. All back to oral cancer. I'm really happy about that video too, because April is Oral Cancer Awareness Month. And I had an oral cancer video from years ago and it was just kind of like dated and old. And I mean, it's still good information, but I was just like, I want people to have the most updated oral cancer information. So we made a new one this year and thank you for saying you like it. Someone just said, oh my gosh, how do I become a dental hygienist? I'm in 8th grade. You got this, Rainbow Dash. Yes. I was like going to do the Rainbow Dash. Congrats for wanting to be a hygienist. So I will say I have an RDH roadmap. I have a free RDH video checklist. I have a lot of resources for someone who's interested in becoming a dental hygienist. How to find them is there's a lot of ways to find them, but this is the easiest one for me. How to find my resource. Type in how to become a dental hygienist, teeth talk girl. So write all those words. How to become a dental hygienist, teeth talk girl in the YouTube search bar. My video will pop right up. Click that video. Of course, you could watch that video. It's a few minutes, but it's not all the details. And in the description box of that video, I have my free RDH video checklist, and it gives you all the details on how to become a hygienist. And I'm so proud of that video checklist. It's solid. It has everything you need to know. So, here it is. And here, if you want to screenshot this right here, here is the direct link to my video checklist. But also check out my YouTube video too, because it's like a summary of this video checklist. And then this is the full checklist, but I'm so excited that you're already thinking about this in 8th grade. That is amazing. And I am so excited for you to join this toothy community one day. Someone said, I have 5 with some teeth help. Isn't that so funny that some people do have supernumerary teeth? Some people have extra teeth. Isn't that amazing? Here's a question. I'm trying to get them all in as many as I can. What determines who gets the ultrasonic scaler versus just the manual scalers? Okay, Giselle, so good question. So I will say a little bit of technique and a little bit of, there's so many variables. For me, I use the ultrasonic scaler on almost every single patient. Research shows that it's the most thorough cleaning is to use ultrasonic first and then go back in with the hand instruments. Now that there is like an airflow, there's more and more technology coming out for different types of techniques to clean your teeth. So one, it depends what type of technology the office has. And 2, it depends on you as the patient as well. We determine, I mean, if you have a lot of buildup versus like not much buildup, I'm using the ultrasonic either way because it's so good to flush your gums with that water. But someone who has barely any buildup doesn't always necessarily need both, but it can only help. It can't hurt. So I use both. But someone who has a lot of buildup, there's no way I'm not using ultrasonic. You know what I mean? But I do use it on every patient just because it's the best. It's the standard of care, in my philosophy. Okay. Hi everyone. I just love how everyone's just like, hi, like everyone's being so nice. Okay, I love your work. Keep it up. I was a formal medical student. Thank you so much for being here. I love how all healthcare industry and healthcare professionals, how we could all come together. Someone asked, will you ever switch it for a wheelchair that moves? I think you're talking, Courtney, you're talking about my one back there. So fun fact, I used to always say it doesn't work, it doesn't move. So fun fact, I realized, guess what? I found the plug for it and it does move. And it could plug in and go up and down, but it's this whole thing and the plug is really bulky and stuff. So I never plug it in, but it can technically move, but it's not connected to air or water. So that's funny. How the heck did you pass these STEM classes? Did they come easy for you? Not at all. I am definitely more of an English major mind. I love communication. I love English. I'm a better writer than I am taking a math test. You know what I mean? Like funny, I love science. So I was a biology major with a chemistry minor. So science is my thing. And because I'm interested in it doesn't mean I'm good at it. Isn't that funny? So imagine if I wasn't interested in it, because if I had no motivation to try, my point is no, I had to work really hard. It did not come easy to me. English, writing, communication, all that came so easy to me. And I was like, what am I doing? Sociology, psychology, I love, psychology is a little bit science. Well, you know what I mean? Social. Anyway, definitely science. But I guess I loved that kind of concept of people and stuff. And I had, I was all right at anatomy because it was like human anatomy. But then when it's like microbiology, my focus ended up being microbiology. All this to say, no, it didn't come easy to me. It was really hard, but I was so focused at the task at hand. I loved it. And I tried really hard. And I do feel I had a math teacher once say this to me, and I'll never forget this. My math teacher, I was really struggling in this math class. It was like really advanced. And I was just like, I was doing fine, I guess, but I would see her a lot because I'd be like, can you help me? I don't know what's happening. And she was so nice. And she said, Whitney, don't be hard on yourself because the people who struggle the most are going to learn it the best. I don't know. You know what? She said that to me and I was like, you're right. She's like, because you're understanding it in a way you have to teach this to yourself. Like if it came easy to you, it came easy to you. She told me I'm going to be a better communicator, a better educator because what didn't come easy to me. Because I'm going to understand it in a way that other people who don't understand it, will be on the same. So that made me feel good. So my point was, if it's not coming easy to you, it means you're just going to be that much better at it. Once you're just going to work a little harder, it's going to, not be that fun. But once you do it, you are going to know it. You know what I mean? So hopefully that was my motivation to you. Okay. We have 6 more minutes. Oh my goodness. I love this. When I turned on this live stream, I was brushing my teeth before bed. Yes, Aaron, we love it. Teeth and teeth. Here's another question. Any help getting past the STEM classes? Just if you need a tutor, do it. There's a lot of colleges that offer free tutoring. And I would go to these free office hours all the time because I was like, I want to get A's if I can. Well, some of the classes I was like, I need a B. But most of the time I was working because I was doing pretty heavy science courses in my undergrad. I was in a pre-dental track at a pretty science heavy school. It was a very challenging science curriculum. So UIC, if anyone, shout out University of Illinois, Chicago. If you've ever taken a physics class there, you know what I'm talking about. All right. Anyway, I would go to every free tutoring office hour session because that comes with it. And I'm like, you know what? I don't know if I understand this and I don't want to find out on the test if I know it or not. So I went to everything, I just did everything I could to try and understand the material. Yeah, but biology came easier to me for some reason, but physics, chemistry, some of that stuff, biochemistry, some of that stuff was a little challenging for me. So I was organic. Someone said, I like your hair. Thank you so much. That is so nice. Thank you so much. I really appreciate that. Okay, this kind of wraps up a lot of the things we were talking about. This is so fun. I'm doing a whole hour and a half. Okay, 5 more minutes. I know. So this is a good question. Wraps up everything. Why do people breath stink even if their teeth are white and clean? So that's the thing. White and clean, just because they appear to be white and clean, that don't mean nothing, right? White and clean doesn't always equal healthy. So you could have perfectly white teeth and you can have rampant gum disease or rampant decay. in the back teeth. If your gums are infected, it's going to smell bad. If you have open decay, tooth decay cavities, it's going to smell bad. So you never know what's going on in the back. Just because the front look nice, you don't know what's going back in those molars. Hello from Florida. You're awesome with me. That's so nice. Thank you. I love everything about you and your content. That's very nice. Thank you, Mr. Oral Reset. Okay, Oral Reset. We love a dental name. I love that so much. Thank you so much. Go Team Teeth. We're all in this together, right? Oh, see, a lot of people are saying this in GE prereqs, and these science and math courses are brutal. I'm telling you, you got this. The same 911 baby go. Yes, it's not always easy for all of us, but just know you can get through it. When you want something, you can do it. Patrick, thank you to your videos. I've been taking better care of my dental health than ever before. I appreciate it. I love hearing this so much. I'm so glad we can all come together and truly spread awareness. Please press like on this video if you've been here, or if you're here right now. The more likes this video gets, the more awareness we can spread about dental health. And if anyone has any other, or if anyone comes across this video and happens to have the same question one of you asked that I was able to answer, you know what I'm saying? Like, this can help people. So I really, I'm so happy we're all in this together. So hi to everyone. Okay, someone, let's see. Okay, I got like one or two more questions, right? Any tips for severe dental anxiety? Yes, we were mentioning this a little bit earlier. Like, my best advice is communication is key. Always tell your dentist and or your dental hygienist that you are a little nervous. Like, let them know, because if you don't let us know, it's always so hard for me to gauge. Like, did this person just have a bad day at work? Like, you know what I mean? I don't know why they're acting a little fun. So like, let me know, like, hey, Whitney, like, I'm here. Just so you know, I'm a little stressed out. You know, I don't like the dentist. And then we can talk through it together. We can figure out, is it the noises you don't like? Is it the sounds? Is it the fear of pain? Is it the fear of the unknown? You know what I mean? We could work through it together, and I could accommodate your needs and bring you to comfort. And always, it can't hurt. Earplugs or AirPods, listen to your podcast, listen to your music, weighted blanket. If you ask them to put the why? The x-ray, the lead apron on you as a lead weighted vest, that can help sometimes. So I hope that helps you. And I'm really proud of you. And just remind yourself that you're doing great just showing up at the dentist. Do you know what I mean? Someone asked, how can I remove a popcorn kernel from my tooth? So here's the thing, floss it. You gotta be flossing. A water flosser can help if you're struggling, because sometimes people are like, oh no, I'm scared I'm gonna push it down more. Maybe a water flosser to loosen it, and then the floss pick or the flosser. These little sides of floss picks, when you have a floss pick, sometimes this little pick part can help. I don't know if you can see this, but there's like usually a pick end, even like a toothpick, something to kind of pick it out. You never want to use metal though. Always make sure it's like plastic or wood. And then and it should get it out. Brushing, flossing, water flossing. And if it's not coming out, it's hurting you, call your dental office and we can get it out for you. I don't know if you remember me. Okay, Ashley Lynn. But I actually started watching your vids before I became a hygienist. I'm now, why wouldn't I, wait a second. Your name looks familiar, Ashley Lynn. I'm now a fully licensed hygienist, about to get my first license renewal in June. Ashley, congratulations. That is huge. Did we message on Instagram? I think we did, right? You message me after this. Be like, hey, I'm Ashley Lynn. I wanna review our combo, because I think we talked on Instagram. Congratulations. This is so amazing. I'm so proud of you. Hey, dental hygiene student here in second semester. What's an easy way to explain periodontal disease to a patient who has a few 4 to 5 millimeter pockets? Okay, Alyssa Rodriguez, amazing question. So this is my last question. I'm going to give you a quick, brief 30-second overview, and then this will be my last question. But I will say, if you want to search, like, I'm trying to think what that video is called. Yeah, I think I put it as reversible. So this is what you should search. Gingivitis, reversible, teeth talk girl. And I talk about the difference between gum disease being on a spectrum, right? On how gingivitis can be reversible. And then if you don't reverse it, then we get into that periodontitis, and now we have bone loss. So check out that video of mine, and it's going to be a lot more articulate than whatever I say right now. But gingivitis reversible teeth talk girl, put that in the search bar on YouTube and it'll pop right up for you. But really quick answer for you right here. That's what I always tell them, like, hey, you have 4 to 5 millimeters, depending on if there's bone loss or not, blah, blah, blah. I show the x-rays. I'm a very much show, tell, do type person. I always am. I have their x-rays up so I can point and show them while I'm explaining it. I feel that helps a lot to have the visual aspect as well as the hearing it audio aspect. So I'm showing them like, hey, here's the areas, here's your perio charting, these 4 to 5 million, I give them all the evidence, and then I explain whether it's reversible or not. If it's gingivitis, if we do this cleaning, non-surgical periodontal scaling, whatever it is, we have a chance for this canal to reverse. Or if it's bone, if they got bone loss and it's like, 6, 7, 8 millimeters, we explain how like the goal is to stop it where it is right now. We don't want it to get worse. We're not going to be able to make it better with this cleaning, but we're going to stop where it is and keep it and maintain what we have. That's what I just feel like that's very easy way to explain it to a patient. And then of course, if you are getting into maybe giving a referral to a periodontist, something like that, then I'll explain that too. Like, hey, bone grafts, gum grafts, there's options, blah, blah, blah. But the basic thing is what I just said there. And also that video, gingivitis reversible teeth talk girl, it'll pop right up. And I really, really hope that helped you. And thank you to everyone for being here. This was so lovely. I feel like I was able to get through a big chunk of a video. Oh, sorry. I just saw Ashley just said, I don't think so. I did comment on a few of your videos and I replied. I'm going to double check that. Okay. I'm like, okay. Well, either way, I'm so proud of you for you're a dental hygienist. You know what I mean? That's amazing. You've joined this amazing community. So thank you all for being here. I just saw Samantha said this is your first live stream, or this is the first time you were at a live stream, or this was your like 28th live stream. I don't know. I've been doing this a few times. I know it's over 25 times because I remember saying like, this is my 25th a few times ago. So it's probably like 28 or something now. But thank you all so much for being here. I tried to get through as many as I could, and I usually do an hour or an hour and a half. So next time, be sure to get here early. I always try to like go in order. And I'm so happy that, again, I know I keep saying this, but I really mean it. How cool that we have this community of teeth enthusiasts. We all care enough to hang out here to talk about teeth. That is so cool. I love it. I'm so thankful for this community. I feel all your energy, and this is real life. Like, we're all alive right here. And like, this is so cool. And just keep spreading awareness, pressing like on this video, that helps spread awareness. Thank you so much for your support. And if you want to support this channel even more, of course, go to youtube.com/teeth talk. That's me. And then you could join the channel membership. I know Patsy was so nice to, thank you so much. Patsy, gifted 5 memberships. So if you're one of the 5, I'm so excited for you to join our membership community. And if you want to get your own membership, try it out for this month. You can do it right on my YouTube channel. It's just like a Patreon, but it's here on YouTube. So thank you again. Thank you, Patsy. You are so nice. Oh my goodness. Thank you. And I hope to see you all soon. Peace. Let's all do it together. I love this in yoga when I do virtual yoga and we all like breathe together. It just feels so good. So if you feel compelled to do this with me right now, you should do it because it really makes me so happy. I know it's fluctuated throughout. We've had like between 94 and like throughout. There's like 96 people right now. Let's just feel the energy. Ready? You know it if you know it. If you don't, join in. Peace, love, and teeth. We'll do it one more time now in case you didn't know it. Oh, I love someone said peace, namaste, peace. One more time. Peace, love, and teeth. I love it. It just feels so good that we have this community. Thank you all for being here. I'll see you all next time. Bye.